on further discussions and would welcome those discussions. And hopefully we can come to some kind of meaningful conclusion as to what should be included in those in the language for the trigger indicators.
Thank you.
Thank you.
Hi, my name is Karen Stenson. I'm with the Long-Term Care Ombudsman Office in San Luis Obispo County, California. I'm also a board member for the California Long-Term Care Ombudsman Association. And Tippy had mentioned the letter that went out. It went out to several folks from licensing and to this committee, and we are a part of that. One of our biggest, well, first, we do support the staff recommendation to hold this and to open it up to stakeholders. This was done very quietly without any input from stakeholders, and that doesn't really work, as you heard in other issues that you've heard today. And I would point out, as a humanity side of this, every week in our office we get family members coming into our facility looking for information on facilities, on the care facilities themselves. We as ombudsmen cannot give our opinion on the places, and so families and their seniors rely on the licensing reports to decide where to place their loved one, particularly their very frail senior elderly person who's going to need a lot of care in a 24-hour care facility. If those reports are down to just these abbreviated visits, they're almost useless. For instance, one of the trigger or the key indicators or zero tolerance items is going to be if there's an open body of water. In San Luis Obispo County, we have 4 facilities that have swimming pools. That's not a helpful indicator for anyone deciding whether or not they want to place their loved one there, and really needs to be re-looked at. I'm almost, after today, really feeling like there needs to be 2 different sets of stakeholders on this, both the child care and the elder care facilities. There's such different issues. It's really important that we provide these people with comprehensive visits in the elder care facilities where they're there 24 hours a day, and they're very dependent on what is being put into those reports to make a good decision and make sure that they're actually putting someone where there's health and safety issues in place. And we also highly recommend that this be put into the policy process. This is a major policy change. It's not a budget problem. This is a policy change, and we would like to be a part of that. Thank you.
Thank you.
Randy Hicks, California's Disability Rights. I would like to also point out to you there was a report done called Dangerous Caregivers about caregivers who lived in nursing homes, who went from one nursing home to another nursing home because DHS and DSS didn't talk to each other, because one agency didn't talk to the other agency. They didn't know that this guy committed a crime or this lady committed a crime, and they got away with it continuously. And that's something else you're going to have to look into. And the other one is that one of the revocable offenses was not financial crimes. Financial crimes has hurt elderly and disabled people more than ever. They've been taken advantage of more times than not. And so that's another thing. Maybe we should look at the protocols on which you guys considered a fireable offense and what they can get away with. And the other thing is the disability community. Yeah, we didn't know about this either. I can tell you that California's Disability Rights California, or any other disability organization was not part of this. And if you do have us a part of this, make sure that all the materials are accessible.
Thank you, Randy.
Good evening. I'm Julie Marvin, and I'm here representing the California Child Development Administrators Association. And I also am the manager of subsidized child care programs in Shasta County. And the first thing I want to say is that we are very much in support of annual inspections, and we agree with the compliance protocol. However, we're very concerned about another increase in fees, not only for our child care providers in our communities, but also for the California State preschool programs, who are already struggling with an inadequate standard reimbursement rate. We are also very anxious to be a part of any discussions. Thank you.
Tim Fitzharris with the Child Development Policy Institute and the Professional Association for Childhood Education. We've been advocating for annual inspections for years, and we're very pleased to see this. The protocol thing is new to us, but we think it has a lot of possibilities, particularly because other states have done some reliability checks on it. So we want to work with the department on how that comes to fruition. And certainly the pilot, if you're doing that child care pilot early. But always, in the last 4 or 5 years, we've turned to pay for this by raising fees on licensees. And as the Alliance for Children and Families and other groups have already said, flat rate programs can't absorb it. We've had fee increases, 3, I think, in the last 6 years. We have a frozen standard reimbursement rate. We've had no COLAs, and again, no COLA, maybe a negative COLA this year. And what winds up happening, particularly for smaller programs, is we've taken everything that we know how to do. You're winding up affecting the workforce and our activities for children when you talk about any new monies being taken out. The last thing I want to leave you with is it's really, you're the state, you're paying for the flat rate to pay these people to do it, and then you're taking the money and put it in your other pocket to back this program up. There are federal funds for this kind of thing. There are other places to go. I would encourage you to avoid another increase in fees. Thank you.
Thank you.
Mr. Chair and members, Jennifer Fisher with the California Alternative Payment Programs Association. We are in strong support of annual visits and have been for quite some time. We are excited about this new idea, and we would request that alternative payment programs be part of the stakeholder process. Thank you.
Thank you. Any comments from members? No. On this item, we have a recommendation to hold it open and direct DSS to meet with stakeholders, inviting legislative staff and including those who have expressed concerns and opposition. You heard them all. For a thorough briefing on number 1, the particulars of the assessment tool, number 2, the proposed inspection protocol, and number 3, the administration's proposed trailer bill language prior to the May revision, and report back with an update to the subcommittee staff on the issues raised and how the proposal might change to address these. We have a motion and a second. Call the roll.
Delatorre.
Aye.
Bell. Emerson. Nistandy. Blumenfield.
Aye.
Monning. As 5.
Before we do the on-call items, I wanted to double back on issue number 4. This was Assemblymember Bell's request to DSS to work on how we can maximize federal compliance with the work rates that are required by the federal government. So they were to put groups together, identify resources, et cetera, that could be used to do that. All right. The on-call items, they're just going to tell us what they came up with. Nothing formal, just tell us what they came up with. On vote only, issue number 3, item number 1.
Blumenfield. This is.
Yes.
Rejection of the request.
Aye.
Blumenfield, aye.
Vote only, issue number 7. Reject.
Okay. Blumenfield.
Aye.
Okay. Has 4.
And issue number 7 on items to be heard.
Aye.
Blumenfield, aye. Has 4.
I read the one.
Okay.
Emerson on
Emerson, aye.
vote only, number 1.
Emerson, aye.
Thank you all very much. We are adjourned.